Welcome. I'm John Collins and I'm with the Parkinson Society. Parkinson Society Canada is launching the Get It On Time campaign to make sure that people with Parkinson's in hospitals and care facilities get their medication on time, every time. When people with Parkinson's don't receive their meds on time, their symptoms can get out of control and they can become very ill. The Central and Northern Ontario region is the first region in Canada able to provide these Get It On Time in-services and this video, and we're very excited to be able to do so. I'm here today to give some general Parkinson's information, to talk about the symptoms and their management, and we'll talk about Parkinson medication and how it relates to this new campaign. More than that, I think this video is here to help make your job easier. We understand and respect the significant challenges in providing care to an overwhelming number of patients, and I think that we have some tips in this video that can help make your care of Parkinson's patients that much easier for you. Parkinson's occurs when dopamine, which is a naturally occurring chemical in the brain that helps regulate movement, cells die or become impaired as part of a change in the chemical makeup of the brain. With insufficient dopamine in the brain, the symptoms of Parkinson's appear and activities of daily living become a little more difficult. Parkinson's is an individual condition and no two people will experience it in quite the same way. In particular, a person's response to medication often differs, so try not to compare or anticipate a person's response based on what you've seen in another. Treatment is individual and medication has to be prescribed to suit the particular needs of each person. People will have different times of day, frequency, and forms of medication, even if they're trying to control the exact same symptoms. Parkinson's is a progressive condition, and as it advances, which is typically when people will be arriving in a care setting, new and more symptoms appear, and the existing symptoms may be less responsive to treatment. The four main motor symptoms of Parkinson's are recognized by the acronym TRAP, T-R-A-P, which is sometimes how people with Parkinson's will describe the way that they feel within their own body. The T stands for tremor. This is a rhythmic back and forth movement of a body part. It tends to be more pronounced at rest and should dissipate with voluntary movement and with focused action. Even though this is the symptom that people most often first associate with Parkinson's, it's worth mentioning that not all tremors are Parkinson's related. Not everyone with Parkinson's will show a tremor, and for those that do, it's unlikely to be their most disabling or disruptive symptom. In fact, Parkinson's is fundamentally about a lack of movement. In its natural state, we're talking about a condition that affects people's ability to move, and to do so safely, rather than causing them to move too much. And that brings me to some of the other symptoms. The R stands for rigidity. This is a muscular stiffness or weakness, and it's caused by a constant stiffness or contraction of the muscles. Along with this symptom comes a resistance to passive movement, which is movement that's applied from the outside or by another person. The A stands for akinesia bradykinesia. Akinesia is an absence of spontaneous movement like a reduced facial expression or a slowed reaction. Bradykinesia is just slowness of movement. The P stands for postural instability, and as Parkinson's progresses, people may lose their natural postural reflexes, may lose an arm swing while walking, and develop a stooped posture, and all of this leads to greater risk of falls. I have a little example that I'd like to try with you that helps illustrate what it's like for someone with Parkinson's. Please place your feet firmly on the ground, bend your knees, place your hands somewhere comfortable, and sit with your spine really stiff and straight and rigid. Now, without being able to bend, I'd like to ask you to stand up. Right, and you can't, can you? It's not that you don't want to stand, it's that your body's presenting some difficulty, and that's just something to keep in mind for people with Parkinson's. It's important to acknowledge that not all the symptoms are visible, and it isn't just things that you can see. It's also important to remember that, like the motor symptoms, not everyone will experience all of these symptoms, and people are going to experience them differently. There's a long list of non-motor symptoms that can affect people with Parkinson's, and I'm going to take the time now just to highlight a few of them. There are a number of common emotional changes that can come along with Parkinson's, and anxiety is a big one. This is problematic because it can aggravate some of the existing symptoms of Parkinson's. The slowness of the gastrointestinal tract can lead to bowel obstruction, which becomes life-threatening for people with Parkinson's, particularly in long-term care. Constipation is very common, and it's important to treat this right away. Dizziness and hypotension are also issues. People with Parkinson's may need increased time, particularly when rising from a seated position or getting out of bed. Try to stay in place for a moment after helping with one of these tasks, and remember to complete all tasks slowly. At this point when speaking, I typically ask a question, and it's what percentage of patients at your facility do you think have some degree of dementia? I typically get a high response, and that's fair because you know the clients that you're working with, but it's important to know that this occurs in a relatively small number of people with Parkinson's. They do deal with some other cognitive issues, like bradyphrenia. Like bradykinesia, this has to do with slowness, but of thinking. Just because people with Parkinson's have trouble communicating or they're a little slow when responding, don't necessarily assume that they don't understand you. Much like when moving, if we give extra time to respond or complete an action, most people with Parkinson's can achieve their desired results. Try to remember to make one ask at a time. If you come into the room and said, okay, we're going to get out of bed, go to the washroom, go get dressed, and go have breakfast, well, that's really 4 asks very quickly. And if someone's lost their ability to properly prioritize or sequence events, they may be stuck on task number 1 while you're hoping to be achieving task number 4. It is important to note that, as we said, not everyone who has Parkinson's will exhibit all of the symptoms that we've discussed, and not everything that looks like Parkinson's necessarily is. There are several other diseases worth noting as forms of Parkinsonism. We refer to these as Parkinson's plus diseases. Within 3 to 5 years of the initial diagnosis, they progress quite differently, and they don't respond to the same Parkinson medications. The 4 Parkinson plus conditions are Lewy body dementia, corticobasal degeneration, progressive supranuclear palsy, and multiple system atrophy. If someone has one of the conditions listed here, they are likely to require more complex care. Please be sure to check their care plan before proceeding. Now we'll talk about some of the treatments for Parkinson's. And we have 3 main forms of treatment. The first is drug therapy. It's the most effective treatment, however, it isn't a cure, and there are some complications that can arise, and we'll get into some of these. There are surgical interventions. The challenge here is that not everybody with Parkinson's is a good candidate, and it doesn't halt the progression, but deep brain stimulation is working well for some people. And then there's exercise therapy, and this is something that we really advocate for. A routine that's developed in consultation with a physiotherapist and tailored to an individual's ability and environment is something that can help delay the onset of disability and maintain muscular flexibility and strength. Treatment with medication, though it isn't a cure, does control the symptoms and can greatly improve a person's quality of life. If we can't cure Parkinson's, we do at least have the medications that can help, and in long-term care, our goal is just to be sure that people with Parkinson's are as comfortable and as mobile as they can be for as much time of the day as possible. Because the symptoms of Parkinson's are unique to each person, so are the medication regimens. Remember that frequent modification to medication, dosages, amounts, and timing by a prescribing specialist is the best method that we have of symptom control. And this brings me to our main focus, getting medications on time. I acknowledge that this is a difficult request, and I also understand that if a person with Parkinson's has a pill at 6 a.m. at home every day, it simply may not happen at precisely 6 a.m. every day in the facility. But if you have support staff who are planning to start their day with a patient at 7 o'clock, for example, well, that person should have their pills by 6 o'clock or 6:15, or the individual time best suited to them. The ideal for the person is precise and proper timing, and this is something that should be adhered to at all times, but try to think consciously about how medication can affect your interactions as well, and try to time your day so the person with Parkinson's is most functional when you need them to be, times when you want them to be able to move to the best of their ability, like eating, preparing for the day, and things of that nature, so that they can be active in their own care and activities of daily living. There are a wide range of medications that are used to treat Parkinson's, and I won't go too deeply into them. I'll just say that levodopa has been the gold standard in treatment for over 40 years, and it helps to improve muscle rigidity and movement symptoms. Levodopa does so by being converted into dopamine in the brain and stored in the nerve cells to replace dopamine that someone has lost. Essentially, the purpose of the rest of the different classes of medications is in one way or another to increase the effectiveness of levodopa and to make sure that as much of it reaches the brain and is made functional as possible. There are some factors that can interfere with the effectiveness of Parkinson medication. As the condition progresses, the symptoms become harder to manage. Any stress, underlying illness, or infection will aggravate Parkinson's and reduce the positive effects of medication. Constipation and dehydration can both slow down the absorption of meds, and generic drug substitution can sometimes be an issue. A big one is that certain foods and drinks, particularly protein and grapefruit juice, have been known to interfere with the effectiveness of medication. We say that people with Parkinson's must have their medications 1 hour before or 2 hours after eating. And of course, this will continue to come up throughout the presentation, but optimum timing of prescribed dose is essential, and we'll talk about why shortly. Now that we've talked about some things that can affect how well the medication works, we'll talk about a few things that you might notice when it isn't working at its best. About 30% of people with Parkinson's will experience a sudden feeling of being stuck, like in cement, where you're frozen in one spot, unable to move, and no amount of willpower can overcome. Freezing can occur when you're initiating movements, like when you want to get up out of a chair, but it happens a little more frequently when somebody with Parkinson's is already in motion and they're walking in an environment that changes, or they're tired or stressed or in an unfamiliar situation. It's a temporary phenomenon, but the sudden inability to move can be both frightening and frustrating, and it can be dangerous too. It's important to note that when someone starts moving again, they're at risk of something called fascination, which is essentially walking up on your tiptoes with a stooped over posture and at an increased speed, which can lead to issues with balance and falls. The next clip that we have is just a quick illustration of what freezing looks like. Now, you'll see here that this gentleman is moving along pretty well until he comes to a change in the tile here and also a change in his direction, and you'll just see this little hiccup in his step. Now, fortunately for him, he was able to get moving again rather quickly. Sometimes we're talking about people who will be frozen for a lot longer. I do have some suggestions for you to give to the person with Parkinson's while they're dealing with a freezing episode. First, ask them to visualize where they're going and plan their movement ahead of time. If they feel themselves sticking to the ground, just ask them to think consciously about standing tall with their feet apart. Some people do well with a verbal cue, someone walking along with them saying left, right, or clapping to establish a rhythm to step to. As far as physically getting moving again, try having the client shift their weight sideways slowly from foot to foot, or ask them to take a step backwards or to the side, and then once movement is initiated, to try walking forward again. Others do well with a visual cue, so ask them to step over a flat piece of paper on the ground or shine a laser pointer in front of their foot. Any type of visual motivator can be useful. Remember to avoid passive movement, pushing or pulling, because the person is resistant to this and you're only going to increase the likelihood of a fall. Also, remember the possibility of fascination. Be sure to stay in place for a moment to see that the resident is moving safely on their own, and consider making use of mobility aids. Now, I'd like to show you another clip to help illustrate some of what we've been talking about. We're using the writing of the date here as an example, and while it isn't clinical, it does show the differences in symptom control. You can see here that Judy is in good control. Her motor skills are functioning well, and she's able to write clearly. You can also imagine how effective Judy might be at dressing herself at this time, for example, and how she could handle other activities of daily living. Now, we're about to see Judy in an off state, and here she's lost her fine motor control. This is just 2 days later. It's the same time, but she's missed her meds. Again, relating this to other activities of daily living, try to consider the limitations that Judy will face with these things. Imagine asking her to dress herself or to brush her teeth, and imagine the level of care that she's going to require. Many people misinterpret this change in abilities as a choice, as someone intentionally being difficult or demanding. But the reality is, for many, like Judy, there is a huge difference between their ability to control their symptoms in an on state versus that of an off. Additionally, some people find that the effects of their medication doesn't last as long as it used to, so there can be times just before the next dose is due when the effects of the drug wear off and their Parkinson's symptoms return. The difference is that this is a more gradual reduction in symptom control as compared to the on-off phenomenon, which is a pretty quick change. In either case, the patient will require more care with simple activities of daily living that could otherwise be completed with minimal supervision or done independently, and they could be more susceptible to severe complications. I'd like to show one more video to help make another point. Dyskinesias are a side effect of Parkinson medication and not a symptom of the condition itself. They can vary from slightly visible twitches and jerks to extreme writhing or twisting movements. Dyskinesias differ from a tremor in appearance, and also, a tremor is more likely to appear when a person is off. Dyskinesias are caused by having too much drug in the system. The dilemma for a lot of people with Parkinson's is a trade-off between increased dyskinetic episodes and maximum symptom control. Before we talk about medication timing, there are a few things that you can do to be sure you get the most out of each dose. Remind the resident to take each dose with a glass of water to aid in its absorption. Avoid breaking, crushing, or chewing controlled release versions of the medication, and don't just double one up if one gets missed. So, why are we out sending the message about timing? Well, getting it on time is important because the uneven release of dopamine means that a person with Parkinson's may notice a big change in their condition and may suddenly not be able to move. They could also suffer from some extremely severe complications, and there will be complications for staff as well. In the advanced stages, a person with Parkinson's is extremely sensitive to a change in their medication routine. Because the symptoms first appeared when only 20% of normal dopamine levels remained in the brain, some years after having developed this progressive condition, very little naturally occurring dopamine is left. They're highly reliant on their medications, and getting the most out of each dose is essential. If medication isn't taken on time, the balance of chemicals in the brain can be severely disrupted, and the symptoms become uncontrolled. Once a medication routine is disrupted, it might take hours, days, or even weeks for a person's Parkinson's to stabilize. And to that point, we're going to hear from Lauren.
My name is Lauren Collis. I'm 61 years old. I've had Parkinson's for about 6 years. This was about 2 years ago. I ended up in the hospital with an ailment unrelated to my Parkinson's. And I went 3 days with no meds whatsoever. And then I started on my Parkinson's meds. I was in the hospital for about 8 days. And at first there's a little bit of resistance from the nursing staff because, again, my schedule of meds doesn't correspond with their schedule of meds. But when I came home, it took me probably 2 to 3 months, maybe even longer, for my body to get back into a comfort state.
People with Parkinson's are constantly trying to find the right amount of dopamine in the brain in an attempt to alleviate symptoms and reduce side effects. What we're trying to do is find the right balance. We're trying to keep people at the line of optimal dopamine levels. If we wait too long to give medication, or we're not giving it at a time when the body anticipates it, then the person with Parkinson's will dip below that line. Intervention with medication provides additional dopamine and can move people back up towards or above the line. The longer that we go between doses, or the farther that someone falls below that line, the harder it is to regulate them and for them to achieve proper health outcomes. When someone is in this dip area, they are more susceptible to complications and they will require a higher level of care. Keeping people at the optimum dopamine level means that they are receiving higher quality of care and you're seeing improved health outcomes in the patient, and their activities of daily living are much more independent. What this chart also illustrates is that there's a continuum of not being able to move to being able to move too much. People with Parkinson's are always seeking this balance, and proper medication timing helps achieve that. In a facility, giving medications at individually prescribed times can be cumbersome. I know that it might not coincide with present rounds and that it may cause some difficulty, but I also know that it can ease the burden for everyone. If medication isn't given on time, staff will probably have to provide a higher level of care. However, if medications are given at the proper prescribed times, you should find that the person with Parkinson's generally requires less help with activities of daily living. Completing daily tasks when the person with Parkinson's is more mobile and independent means that the caregiver's job is easier, it's more efficient, and the quality of life for both parties improves. So we think that the goal to get it on time is mutually beneficial. So what can you do? Use the Get It On Time stickers on a patient's file, in their care plan, anywhere that you can put them to help remind staff of the importance of medication timing. You can talk to people who aren't here or haven't seen the video about the importance of medication timing. Think about using a pill timer or alarm held by staff or by the patient. A big thing is that I realize that there is currently an acceptable window for medication delivery and that your facility needs some flexibility to keep things running smoothly. However, it's crucial with Parkinson's that we pay conscious attention to reducing this window because their window for good symptom control is a lot smaller. Also, consider patient self-administration of medication. This is a larger conversation than our time allows for. I'll just say that the benefits for those residents who are physically and cognitively able are numerous. They know their own condition, it saves staff time and energy, and it helps them maintain their independence. The recently amended Long-Term Care Act does allow for this under certain situations. The most important piece is that medication should never be taken from a person with Parkinson's without an individualized care plan to ensure their delivery, and self-administration is therefore particularly valuable when avoiding gaps upon admittance or when waiting for appointments. I'd now like to show you a video that shows that there can be a positive outcome.
My name is Jean Keary. I got involved with Parkinson's Society Canada when my husband was diagnosed with Parkinson's in 1994. Getting medication on time for my husband when he was in hospital was very important to us. And we've had several incidents at our local hospital. In 2007, when he was in, it was a fight to get the medication on time. There were incidents of staff crushing the controlled release medication. They were given them late, and so it was a constant battle. Then in 2009, I believe it was, he was readmitted. With the change in attitude, the staff were much more aware of the need to give it on time, and so he was able to mobilize better. He was able to participate in the exercise that they did on the rehab, but the actual overall care was what was important.
I include this clip to show you that there can be positive outcomes. As Jean just said, the hospital completely changed the way that they look at Parkinson's from the top down, and this led to better health outcomes for Charles. We know that if it can work at this facility, it can be adapted to work anywhere. Now, I'd like to close with some helpful hints for daily care of people living with Parkinson's. For a number of reasons, including people with Parkinson's own struggles communicating and insecurities about their environment and their abilities, they tell us that they often feel misunderstood in a care setting. Difficulty communicating, both verbally and non-verbally, is often frustrating for the person as their minds continue to be active while their bodies do not always let them express themselves. Remember that just because someone's body is changing, it doesn't mean that their mind or that their attitude necessarily has. Rigidity, slowness, stiffness affects all the muscles from head to toe. Slowness of movement, slowness of thought, difficulty with swallowing, and it also affects those muscles that are related to facial expression. I'd like you to try another little exercise with me. Please take your hands and put them on your cheeks, and pull back tightly on your cheek muscles for me, and hold that for a moment. And now, I want you to smile at me because you're so happy to be learning about Parkinson's today. Right, and it's difficult, isn't it? I'm assuming there weren't a lot of bright teeth in the room. That doesn't mean that you didn't want to smile or express yourselves, it just means that your body was giving you a little difficulty when doing that. And that's just something to keep in mind in relationships with people with Parkinson's. Taking this a step further, I want to emphasize the importance of communicating with people living with Parkinson's and their families. A lot of times, people have been managing their condition for, say, 15 years on their own effectively, and they know all about the person's individual experience with Parkinson's, their individual response to medication, and how to best overcome a freezing episode, for example. Either with regard to timing or feeling an off period coming, the person with Parkinson's and their family are knowledgeable about when a patient will need their next dose. Understanding someone's normal medication regimen can help avoid unnecessary complications and prolonged periods of disability. Please consider implementing a patient's normal medication regimen into their care plan. As far as the individual symptoms go, there really isn't a lot that I can say, as everything is very individual. With tremor specifically, try to remind the person to focus on one task at a time. Keep in mind that stress, fatigue, or underlying illnesses can worsen the symptoms. Consider the use of assistive devices that can help with activities of daily living. In consultation with a physiotherapist, please try to find an exercise routine that someone can do every day. Muscle relaxation techniques are often helpful. Remember the importance of medication timing around meals and medication timing generally. I won't go into great detail on falls, as I'm sure you have some best practices in place that work for your facility. Specific to Parkinson's though, one thing they're prone to is nocturia, Urinary frequency, particularly through the night. If the person has the urge to go to the washroom overnight, consider installing a nightlight, making use of a bedpan, or some other option, and try to be sure to help the resident with toileting before bed, avoid liquids late in the evening, and consider some environmental cues or markers in the room to help keep them safe. We've talked about how rigidity and stiffness affects all the major muscle systems. It also affects those that are related to eating and swallowing. Here's the easiest way to put it. If you try to feed a person with advanced Parkinson's without their medication working effectively or without them having had their meds, they're very likely to choke. The muscles in the throat are slow and rigid as well, and the normal muscular reflexes that prevent choking and prevent food and water from going into the lungs are also affected. That's why we're particularly conscious about medication timing around meals, and it's why we're hoping you will be as well. In closing, all that we're asking is that you consider the information and the difference that it can make for people living with Parkinson's and for yourselves, and that you find a way to make this work at your facility. Please make use of the kits, use the stickers, and find a way to make sure that everyone knows the importance of medication timing for people living with Parkinson's. I thank you for your time.
My name is Elaine Connor. I was a caregiver for a very good friend who had Parkinson's for 17 years. So we got to know a fair bit about medication and its effects and its side effects. And we were always very careful to try and keep it on time, all the time. She went into hospital for surgery after a fall, and subsequently she went to the rehab area nearby. There, the doctor instantly changed her medication schedule by cutting the dosage and changing the times. Despite my loud protests, his attitude was, I can't have my staff doing a schedule like that. They've got other things to do. In 2 days, you could really tell the difference. Her energy was down, her mobility was down, and her well-being was just not good at all. They added a little back, but it wasn't well placed, and she went to the other end of the short dyskinesias. Over a few weeks, she was battling other conditions and other drugs while she was not getting the full strength and energy and stamina that she might have had from these Parkinson drugs. So it was a real struggle. Finally, she had a severe stroke from which she never recovered. Now, I'm not saying that this fluctuation and change in Parkinson medication was the sole factor or the only factor in this situation at all. But it certainly didn't help. It caused her a great deal of discomfort, and it certainly increased the stress level of all the rest of us. Just keep in mind that a Parkinsonian lives with a professionally, individually tuned medication schedule for good reason. Please follow it.